Good morning, everyone. I know you're normally used to Victoria hosting these sessions, but you can't be with us today. So I would like to welcome you to May's PeopleHUB event. My name is Dan and I'll be taking Victoria's place today. As you all may be aware, May is Mental Health Awareness Month, we're currently in Mental Health Awareness Week. My apologies. So we thought it'd be very fitting to invite Able Futures to lead and join us on this session. Able Futures are a fantastic support service for SMEs, and it's a service that employers aren't often too aware of. So I'll be shortly handing over to Fiona Campbell, who will explain a bit more about this service and also why it's very important to support mental health at work. But before I hand over to Fiona, I would just like to thank our sponsor for today's session, 1HR. Mike from 1HR has joined us today, and he's just going to speak for a quick moment about the system, the service, before we get stuck in to Fiona's presentation. So, Mike, if you want to take over.
Yeah, nice one. Thanks, Dan. Good morning, everyone. Very much looking forward to the session today. As Dan mentioned, my name is Mike. I'm from 1HR Software, who are sponsoring this event today. Just want to give you a quick sort of rundown of who we are and what we do. So 1HR Software is a all-in-one HR management software, which basically helps organizations streamline their HR processes. So some of the key features that the software does offer is an online platform to store all of the employees' key information, things like emergency contacts or their key documents, such as contracts of employment. You can also have more company-wide documents on there, such as HR and health and safety policies and company handbooks, things like that. Probably crucially for most of the people that use 1HR, from an employee point of view, you can also request your holidays and your leave on the system. Managers can record employee absence and complete sort of electronic return to work forms. And then the system as a whole has a really good level of sort of automation, so you can set things like tasks and reminders to help keep you compliant, first of all, and also help make sure that no sort of important task is ever sort of forgotten about. So there's a number of other features on the software, but I won't talk too much more about it. I'll drop obviously you can see my contact details on the screen now, but I'll drop a message into the chat as well. If anyone would like a demo of the system or just to speak a little bit more about it, please don't hesitate to drop me an email or give me a ring on the number on the screen now. So yeah, very much looking for the session today, and we're very proud at 1HR to be sponsoring PeopleHUB today. Thanks very much.
Excellent. Thanks, Mike. Now I'll hand over to Fiona in a second, but before we start, so Fiona's going to run us through a presentation, but there will be some time for questions at the end. So you can either drop those questions in the chat here in Zoom, or you can ask your questions via Slido, and we'll have a slide later on in the presentation with those questions listed. If you want to ask a question or get involved, please take a moment to scan the QR code on the screen. If you've got your mobile handy, and you'll be able to ask any questions, and they'll feed through to us at the end of this presentation. But I'm going to stop talking now and hand over to Fiona.
So I'm Fiona Campbell. I'm the integration manager at Able Futures. Angela Han, unfortunately, is out of the business, off on sick for a couple of weeks. So she was going to be delivering the presentation today because she is the business account manager for the northwest of England. We also have a dedicated business account manager for the northeast of England, as well as dedicated business account managers for the south. So Able Futures covers the whole of the UK, England, Scotland and Wales, but not Northern Ireland. So obviously from a support services point of view, we're able to help anybody in the UK. So just before I get into the presentation, I'll just touch a little bit on Mental Health Awareness Week. So Mental Health Awareness Week each year has a theme, and this year's theme is community. And I think it's quite an appropriate subject for yourselves, because this is kind of a forum for bringing everyone together and having that feel of a safe space of information that you can kind of support each other with. So being part of a safe and positive community can be vital for mental health and well-being. Communities can provide a sense of belonging, safety, support, and also gives individuals a sense of purpose. And also people and workplaces thrive where there are strong connections between teams as well. So a couple of examples of maybe how to develop a community within your organization could be encouraging open communication, recognizing, celebrating achievements, not only work-related achievements, but personal achievements. Might be someone's recently got married, might be someone that's just recently run the marathon. We've just celebrated that because our head of delivery for Able Futures ran the marathon last week. Just have a bit of a get to know your team. So maybe social events like everyone go out for lunch, or foods like outside of work, or host bowling events and things like that. And also promote diversity and inclusion so that everyone is able to access the community and feel like they are part of that kind of team and community and have that sense of well-being. So with that in mind, I will get into how Able Futures can help mental health support services. So as I said, I'll introduce the Able Futures and Access to Work. I'll just talk a little bit about why the DWP are investing in providing this service for SME leaders and employees. And then I'll discuss how we support both individuals and apprentices over the 9 months that we work with individuals with their mental health coaches, and then how we can support you individually as an SME employer with mental health at work, and then go through any questions that you might have with regards to Able Futures. So Able Futures delivers the Access to Work Mental Health Support Services scheme. So as I mentioned earlier, it is delivered on behalf of DWP through England, Scotland and Wales. It is a support service for employers and apprentices. It's a no-cost service. It's fully confidential, and the advice is tailored towards individuals' needs. Now, you might think no cost, nothing in life at the moment is free. But because we are fully funded by the Department for Work and Pensions, there's no cost to individuals to access it. There's no cost to an organisation to access it, to promote it, because the DWP pay Able Futures to support the participants who are on programme. So that's why it's at no cost. So with regards to the importance of supporting mental health at work, so mental health and poor mental health is increasing every day. It's always kind of been a bit of a taboo subject. And at the moment, it's saying that 1 in 4 people experience mental health problems each year. And the WHO estimate around 15% of working age adults do live with a mental health condition. I can probably see that going to be like 1 in 2 in the near future, because it is becoming more and more apparent that people do need support with mental health. So mental health can affect employee performance through anxiety, stress, depression, trauma, a whole host of different issues that might be going on with that individual. But an individual might think, well, actually, I'm at work, I'm here, I've not got any problems with my absence, but they might be displaying signs of presenteeism, for example, that is still affecting their performance at work. And all that equates to around 117.9 billion each year to the UK economy of poor mental health. So why is all that relevant? So just a little bit of a breakdown. Absenteeism, according to Deloitte, is estimated around 7 billion. Presenteeism, which I just touched on, is around 24. And then obviously that equates to staff turnover, with having to make people leave the business because of absence records or people leaving off their own accord. So total cost is around 51 billion. So it does really kind of add up to the UK economy about how important it is to try and support organisations and their staff with mental health. And the programme that Able Futures have been running through the Department of Work and Pensions, we've had it since 2018. It has been going since 2011, and I just don't think there's enough awareness of this programme even out there at the moment to say, you've got this programme. It doesn't cost you guys anything to access. It doesn't cost an individual to access. So it's really just, the purpose of these sessions is just trying to get the word spread that there's this support service programme out there to support yourselves. So we move on to the next slide. So the impact of poor mental health on the SME and self-employed sector is quite staggering. 85% of small and medium-sized business leaders said that their mental health was the biggest health and safety challenge for 2023, because obviously one person being absent from work due to ill health, be it physical or mental, can have a really big impact on an SME organisation, whereas it will still have an impact on a larger organisation, but because you've got a larger number of staff to turn to help, I don't think it impacts them as much. A new study conducted where it said that 4 in 5 small business owners reported experienced common symptoms of poor mental health at least a few times a year. And also 30% of small business owners said their employees reported a decline in their mental health since COVID-19. We've really seen a testament to that. Our numbers have doubled with the amount of people that we're supporting. We used to be on average about 600 people a month before COVID would inquire about the service of Able Futures, and then about 400 would be starting on programme. We are now seeing numbers of 1,100 expressions of interest a month to come on programme, and that is equating to like 800, 900 referrals a month. So we've really seen that difference since COVID-19, and it's just now more than ever, I think organisations need to be aware of this programme that we offer. So how does Able Futures help mental health at work? So you can jump to the next one. Perfect, thank you. So support for employees and apprentices. So Able Futures is there to try and be preventative. It is there to try and make people aware that their mental health might be impacting them at work, and to be more of an early intervention programme. And it's helping individuals cope better with their mental health challenges and help them be more in control of their mental health rather than their mental health controlling them. So it's a self-referral programme that Able Futures offers. So as an organisation, you can promote Able Futures, but it has to be down to that individual to self-refer onto the programme. They will get support from a dedicated mental health coach who is employed directly by Able Futures, who will spend time with that individual to understand their specific needs and what support would work best for themselves. They receive advice, support, guidance during the 9 months that they're on programme for, giving them the coping strategies so that they feel more in control and starting to have more good days than bad days. As I've touched on, it's fully funded by the Department for Work and Pensions, so there's absolutely no cost. It can be delivered either via Teams, via email, via phone call, or face-to-face if required as well. Pre-COVID, everything was done face-to-face, but obviously with the numbers we're getting, it has gone a lot more remote. But if an individual does want a face-to-face appointment, we can absolutely accommodate that. So with regards to eligibility, so it's open for anybody who's over the age of 16. They're in paid employment, self-employed, an apprentice, 0 hours contract, or about to start a new place of work. It is for someone who is attending work. They can be off on long-term sick, and or, as I mentioned, have that start date for offer of employment. And it's where they are experiencing problems with their mental health. Now, their mental health conditions don't have to be diagnosed by a doctor. It can be, as I mentioned, anxiety, stress that they are experiencing themselves and they've not reached out to anybody else for support. But it's where their mental health is having an impact on their working day. Now, it can be specifically to work that is causing those specific issues, or it could be something outside of work that's impacting them during their working day where they may be showing signs of presenteeism. So as I said, they'll touch on the monthly sessions, they'll get the advice, support and guidance. It would benefit someone who would support from the early intervention to address mild or moderate issues. They may be not receiving support from elsewhere. I would say if they are receiving support from elsewhere, it's just sometimes you can have too much support going on. So we would assess that to say, can you cope with another support service program. So those are the types of conversations we'll be having. But Able Futures is not a crisis service, and it's not suitable for someone who has complex needs. I'll touch on that a little bit more because it just depends on their complex needs and what support they are getting. So with regards to kind of the program that for people it's not really going to be suitable for, it doesn't replace any existing healthcare or support being available to employers that are being provided by your organisation. It doesn't replace any wellbeing schemes, and we don't provide clinical support such as counselling. Able Futures is a non-clinical service. Now, people still think Able Futures is counselling because they're having that one-to-one conversation with their mental health coach. They're discussing what's going on, so they might view that as counselling, but it's not a clinical version of the counselling that we provide. So with regards to supporting employees, as I said, it's confidential support. They meet with their mental health coach. It's over 9 months, and it does focus on building skills to maintain mental well-being and knowledge of how to access a treatment as well. And it just, sometimes when an individual is struggling with mental health, they're very much blinkered and they just think, there's no other support out there. And through the work with their mental health coach, we'll just kind of take those blinkers off and just see what other support is available to that individual as well. The next slide just touches on our mental health coaches that they may kind of get assigned to. As I've mentioned, all Able Futures mental health coaches are members of either the BACP or becoming members of the BACP, but more importantly, they're all employed directly by Able Futures. So we have full sight of caseloads. If for whatever reason an individual isn't quite gelling with their mental health coach, we can assign them a new mental health coach as well. So we've got complete sight of that, and we felt when we bid for the contract, it was important that all our mental health coaches were employed directly by Able Futures. So I've touched on the support that they get with regards to their coach, but they also get access to 2 new features on the Able Futures program. The first one is Ellie. This is only available to people who are specifically on program. It's not available to yourself as an employer. Ellie is described as a Netflix-style user experience. There's over 6,500 lived video experiences. There's directory resources. There's podcasts. There's a whole host of different things around different topics around mental health. And this has only been introduced to Able Futures since we got the contract again back in August last year. And participants are really enjoying this platform. It's something that they can access during the time they're on program, but something they can also access once they've come off program after 9 months. So we leave them with a little bit of a safety net that they can access. But then also what they have access to, if required, is a neurodiversity profile called Do It. This isn't available to every participant on program. It is very much at the discretion of their mental health coach. If we feel that a participant is displaying kind of signs of neurodiversity conditions, we would then maybe offer them to go through a Do It profiler, which will then kind of highlight specific areas which can help them with regards to specific support, how we deliver that support to individuals on the 9 months that they are on program for. I'm not clinical, I'm not a mental health coach, so I've not had full access to this as yet, but it's becoming a good resource as well for individuals to kind of just get a bit of a summary of how they deal with things and maybe what certain triggers that they will experience as well. So with regards to the support that we give them, it can be on time management, problem solving skills, coping with change, sleep diaries, anger management, a whole host of different coping strategies that we can work with individuals on. What I would say is if we've got individuals who are on program showing signs of anxiety and stress, their support plans might be completely different, because what works for one individual might not necessarily work for another individual. So each individual 9-month program and 9-month journey that they're on will be very, very different from the next person. So in a nutshell, the next slide just explains kind of the journey that an individual will come on. So as I said, it's a self-referral either through the website or on our free phone number. We'll go through the eligibility. That gets sent off to DWP for checking, because obviously they're funding this program. Are they eligible? If they are, we will arrange an initial appointment for that individual to meet with their VRC. Sorry, they used to be called VRCs. They're now called mental health coaches. They'll have that mental health appointment and go through a support plan. They'll have regular catch-ups with their MHCs. At 6 months, they'll have a formal review just to see how they're getting on program. And then month 7 to month 9 is very much light touch, just to try and wean them off program so that when the 9-month appointment happens, they know what to expect. It's not just, that was your last appointment, you're on your own. During this time, an individual can disengage from program at any point. However, once they've disengaged, they can't come back on program. DWP in the last contract that we had would allow an individual to come back on program if there was a significant change to their mental health conditions. Whereas when this contract renewed last August, this is one stop, you get one chance, and that's it. So we would very much encourage individuals to be on program for the full 9 months. If at month 3 or 4, they might say, I'm in a good place, I'm happy, we can do light touch support and just have that individual still on program. So if they were to have a bit of a wobble a couple of months down the line, they can still reach out to their mental health coach, and it's just there as a bit of a safety net. The next slide just touches on kind of what individuals have said about being on program. We've got case studies coming out as well that are on our website. So this just kind of highlights everything that I've said is kind of what participants think of it. So I won't go into that too much. These are the self-referral options, as I've mentioned. So that's the journey from an individual, but how can we support you as an employer? So you'll get your own dedicated business account manager. So if you're in the Northwest, you'd get Angela. If you're in the Northeast, you'd get Jonathan, and in the South, you'd get Debbie Burns at the moment. So we can provide you a toolkit to try and understand mental health. We can deliver Able Futures awareness sessions such as this. We can provide you with physical promotional materials. We can send it out digitally for you guys to print off and promote in your organizations. And we can discuss them around maybe making adjustments and planning responses to anybody that is struggling with their mental health. So it's really much about, again, where the journey for a participant is very unique, the journey for an employer is very much, excuse me, unique, because again, what might work for one employer might not necessarily work for yourself. So if you have, say, 200 employers and you want to do launch sessions with Able Futures across different months, that's absolutely fine. You've got us throughout the journey. So we will support you with regards to different webinars we'll be doing on certain awareness topics throughout the year. If you launch us, say, this week and then want to do a refresh 6 months later, that's absolutely fine. You'll also get access to our newsletter that just kind of touches on maybe different hints and tips, what we've been doing, what employers have said that's working for them, just to kind of give you that different support as well that other organisations are working on mental health. I've just seen a question come up from Alison. Oh, it's just disappeared, just bear with. So that's a good point, actually. I didn't touch on that, Alison. So the timescale for referring someone onto program to them starting with their mental health coach is 30 days. So it is no waiting lists, and it is quite a quick turnaround. So thank you very much for that question, Alison. That's quite an important one that I completely forgot to mention. So just the last slide really is just, again, feedback from employers that we've worked with, how they've integrated Able Futures as part of their mental health toolkit, how it is different from an EAP. If you do have an EAP and that offers, say, 6 months, 6 sessions of counselling, and that individual does want counselling, we'll always try and refer them back into other support that you've got. I describe Able Futures as another first aid box at the disposal of an organisation, because counselling doesn't work for everyone. Able Futures might not work for everyone. It's just there as a just in case. And that's it. Any questions?
That was really, really, really insightful and handy. I think sounds like a really valuable service, particularly when you talk about the likes of absenteeism and the costs. It's probably something that we're overlooking as business owners. We see a spike in absence, but don't necessarily attribute to that to poor or declining mental health.
Yeah.
Failing to connect those dots.
It's when individuals ringing up and saying, I've got backache, I've got stomach ache, but actually it's something happening at home that might be impacting them coming to work. So it's just trying to, again, it relates back to the theme for mental health awareness, where you just have that encouragement and safety net of workplace communities where they can reach out.
Yeah, of course. So we've got a question here that's come through that's asking, how can we encourage our employees to make use of these services? I can understand maybe some people might be hesitant to engage with them.
Absolutely.
So how can we encourage that?
So Able Futures is completely confidential. So that this is kind of the main stigma attached to any offering that an employer has with regards to services to help an individual. It's that uptake, and it's a self-referral scheme, so it's down to that individual to want to have the help rather than an organization saying you have to have this. I think if you just promote Able Futures and they know where to access it, with maybe not asking managers, asking through like HR, for example, of where to access an EAP or Able Futures. So if you've just got posters up in staff rooms and toilets, they know where to go to kind of how to refer without anybody knowing. And I think it's just breaking down that barrier to say you don't have to ask anyone, you can do this without anybody knowing. Also as well, it's fully confidential, so they don't have to disclose to you as an employee that they're on program. They can if they want,
Right.
but they don't have to. If it's apparent it's a work-related issue that's causing them their mental health conditions, we would try and encourage them to let work know. But again, it's a complete, they're in control of who knows what. And this can be us reaching out to their doctor to try and get additional support. If they say no, we can't do anything. So they're fully in control with regards to that. So I'd just say constant communication and just have that accessibility of knowing where to find information without having to specifically ask for it.
Perfect. So the next question we've got here then is there a big difference in the number of employees that are diagnosed or not diagnosed, I'm assuming, with a mental health condition that use the service?
I don't have the stats specifically around that, but it is probably a lot more undiagnosed than diagnosed, because again, since COVID, everyone's suffering more with stress, with anxiety. There's financial strains on everybody. So I'd say it is more undiagnosed than diagnosed.
Yeah.
Say to that, but I can try and find some stats around that and get them sent over to you.
Yeah, that'd be excellent. That'd be excellent if you could. Okay, thank you. Okay, so the next two questions, I suppose we can kind of tie them together a little bit because I think they relate to the service itself. So first question is, how do we as an employer access Able Futures? And then if possible, could you just briefly touch on the neurodiversity screening again and what that process looks like?
What I'll do on the neurodiversity screening, I'll put hands up, I'm not 100% confident with regards to kind of the ins and outs of it. What I can do is a link to it, because I'm not through it myself, because Angela would be more fully up to speed on this because she delivers this every day, whereas because I sit between the sales team and the ops team. But I'll send the link out for you to share it so you can have a look at it. But I don't want to say something on there that's incorrect.
No, not a problem. No, after this session, we'll be sharing the recording so we can have that information or those links included as well for anyone to kind of follow up
So how, as an employer, do you access Able Futures? There is two or three different ways. You can either do it through the phone number that's on our website. We've got an expression of interest form on our website as well that you fill in. That comes to myself, and I allocate it to the relevant business account manager to reach out. Or If you're in the Northwest, Angela won't mind if I share her contact details. You can contact her directly, but obviously she's off on sick at the moment for another week. But I'll say the best way is through our website and filling in that expression of interest form. And also I'll just tie in, yes, we are absolutely able to offer in-person awareness sessions. It's something that we used to do more so face-to-face prior to COVID. Since COVID, everyone's gone into more the remote way of working, but we do like to kind of get out there and kind of offer the in-person ones. We can do staff launch sessions face-to-face. We can come in and do presentations. We can come in and even sometimes I've done it before back in the day where I've sat in kind of canteens and just kind of been there as a visual for people to come up and inquire. So absolutely, that can be something that you discuss with the business account manager in your area as well. If the person ends up needing support for more than 9 months, what do we do? So during the 9 months journey that an individual's on, it might be apparent that they need more specific support or additional support. So again, with the consent, we'll start the ball rolling and maybe looking at different avenues that the individual can access so that when they leave us, it's not, that's it, you're back on your own again. They've got a little bit more of an idea of what support's out there, what applications maybe to counselling sessions. We might have linked in with their GP to kind of look at specific issues that they've been struggling with. So it's very much during that 9 months, it will become apparent about what other support that they'll need. As I said, they do have access to Ellie once they do disengage from the program after 9 months, so they can always refer back to that. But after the 9 months, unfortunately, that is when our support ends. But hopefully, during that journey, other doors have been opened for that additional support that they may need.
Excellent, excellent. I've had a question in the chat from Laura just asking, are we able to watch this session back later? And yes, following the session, we will be sending an email out to all attendees with a recording of this session, along with the information that Fiona has touched on as well, any links to any information on the neurodiversity screening or any contact information for Able Futures specifically as well. So before we kind of look at closing the session off, are there any additional questions or queries that anyone has for Fiona while she's here on the session? If you want to drop them in the chat or if you want to unmute yourself to ask, that's absolutely fine. Otherwise, we will move on to our next slide. If that's okay, please, Maisie. So peopleHUB will be back in July. We don't have a set topic or speaker at this moment, but if you are a member of the peopleHUB community, you'll be able to receive updates via email or on LinkedIn. If not, if we go to our next slide again, you can join our community either on LinkedIn or Facebook, where you'll be able to get early access and information to those events. Otherwise, I would really like to thank Fiona for taking the time. I know you were kind of thrown into this session, but I think it was really insightful and you've provided information on a really useful resource for employers and, of course, employees as well. Oh, so sorry, one moment. We've had one more question in the chat here just before I cut everyone off, but are there any marketing materials available to promote Able Futures to employees? So I guess we're talking about any kind of PDFs or guides or...
Yeah, absolutely. What I can do, I'll send the PDFs over of our digital marketing pack to yourself, Maisie, and then you can distribute to people that have been on this call. I think that's probably the easiest way of doing that, if that's okay with yourself.
That's absolutely fine. We'll capture all that information, those documents, those resources, and make sure that everyone who's on the session today gets a copy of that information.
What
You
I
can
would
also
say
see...
sorry, for Caroline, if she does want more of a dedicated account management process like you have with Angela, just drop us an email and we can kind of get that ball rolling as well.
Excellent, perfect. We can see Fiona's details on the screen here as well if you want to take a note of that information. But yeah, Again, I'd really like to thank you for taking the time, Fiona, and to everyone else for joining the session.
No.
And if there are any questions or queries that anyone has off the back of this session, as we say, we'll share Fiona's details, you'll have our details, so please don't hesitate to get in touch. And hopefully you'll make use of this service that can really make a difference for the people within your business as well. Otherwise, thank you everyone else for joining. Hope you have a lovely rest of your day, and I hope to see you all on the next People Hub session. Thank you.